the message of some healthy habits. So get your brain and body strong and get the kids to college.
A singing vegetable lady?
No diabetes.
Dancing fruits and veggies. Patients shopping for bargains on fresh produce. It may seem out of place in a community health center, but the Harris County Hospital District sees it as a significant step toward improving health care. Well over half the adults in Harris County are overweight. The vast majority are considered obese, so overweight that it's considered a serious health risk. 40% of our children are either obese or overweight. All of this excess weight triggers a cascade of medical problems, especially chronic long-term conditions such as diabetes and heart disease, which will plague patients for the rest of their lives.
As a clinician, I see patients coming in with a lot of chronic diseases, high blood pressure, diabetes, high cholesterol. And one of the things that I know to tell them is to try to improve their diet, and largely that's by eating fresh produce, healthy fruits and vegetables.
But as medical director for weight management for the Harris County Hospital District, Dr. Ann Barnes knew her patients couldn't always practice what she was preaching.
One of the challenges that patients have is that it's often really expensive to do that, and it's also really hard to get to stores, especially if you live in parts of town where there aren't very many grocery stores.
With a seed grant from the Harris County Hospital District Foundation, Dr. Barnes created Healthy Harvest, which is making low-cost fresh fruits and vegetables available to patients at the district health care centers. Dr. Barnes teamed up with Renee Gray, who had started Veggie Pals, a local nonprofit that buys fresh produce in volume from area farms and community gardens.
She wanted to reach out to communities in need, and she was looking for a way and a place to do that. And I thought, what better place than the healthcare system, where we actually talk about eating fresh fruits and vegetables, link that with improving health status, diabetes, high blood pressure, and cholesterol, and that it seemed the perfect marriage of those ideas and those missions.
We can provide our patients the opportunity to get quality food at reduced prices. It makes perfect sense because we're into wellness, not sickness. And so our perspective is primary care, prevention, and wellness are the critical elements that we need for strategies that are going to work long term. And why not start with diet?
District CEO David Lopez sees Healthy Harvest as part of a revolutionary approach to health care, a major paradigm shift referred to as patient-centered medicine, or the medical home model. The Harris County Hospital District is on the leading edge of the medical home movement. It has become one of the largest healthcare systems in the country to embrace this revolutionary approach.
What we're doing right now has very significant long-term impact with a reduction in admissions, with less acute care, with more people being healthy. That'll help our community not only with better lifestyles, but also reduce the cost overall of healthcare in our community.
This month, the first Healthy Harvest markets open, one day a week at 5 community clinics. If they prove successful, the plan is to expand the program to all district health care facilities. And judging from patients' reactions, Healthy Harvest is already a success.
For me and for my health, I need fresh vegetables. And it's kind of hard to go into a grocery store where it's very expensive. And here, you can come to your doctor, sit and wait, and have all these beautiful vegetables.
I actually love it. To be honest with you, I shop at Walmart, and I thought Walmart was like the cheapest produce, but I was wrong. It's actually pretty cheap here.
Not only is Healthy Harvest a good bargain for patients, it's a great bargain for the district, and it has the potential to save Harris County taxpayers millions of dollars each year.
We've looked at it from several aspects. One is the availability and access aspect. The other is certainly a financial aspect as well.
Dr. Robert Trenchell is the district's Senior Vice President for Ambulatory Services. Dr. Trenchell's statistics show the cost of providing health services for overweight individuals is nearly 40% higher than for patients of normal weight. Their prescription costs are almost 80% higher. Caring for an overweight patient costs the district $266 a year more than a patient in the normal weight range. If that patient is obese, the additional cost of care jumps to more than $1,700 a year. Dr. Trenchel says this means the hospital district will spend an extra $109 million this year just to deal with the additional health problems of their obese patients. He sees Healthy Harvest as an important step in controlling obesity and consequently the cost of health care.
If we could just take 1 of 5 of those obese patients that we currently have, and we have, I believe, over 65,000 of them, if we could take 1 of 5 of our obese patients and move them into the overweight category, we would save close to $20 million annually for the district. And those dollars could be used for other programs or other health initiatives.
While a farmer's market may seem out of place in a clinic, the district sees Healthy Harvest as a perfect fit with their mission and a truly innovative approach to health care.
Bottom line is this: we're supposed to maintain people's health, not just take care of them when they're ill. We'll do that, but if we can prevent people from being ill, that's what we're all about.
It seems very appropriate that in addition to medical services that we can offer this aspect of preventive health care, which is providing fresh fruits and vegetables. The moment that I'm saying to patients, you should improve your diet and eat healthy foods, I can actually point down the hall and have them go to a farmer's market and purchase those fresh fruits.